Thank you, Rich. Happy Earth Day, everyone. Good afternoon. So exciting to be here today, to feel all your passion and your energy. Just look around, look at all the signs that are here, the kids that are here. Science is important. It's our next generation. Thank you to Congressman Cicilline for being here, for those that are fighting for us on the front lines. Your presence here matters. It's going to make a difference. Keep your voice going strong. Let people know how important science is. It's such an honor to be part of a speaking program with such talented, accomplished people. I want to thank all of today's speakers that have been so inspirational for their wisdom. And I want to thank the organizers for making this incredible event happen. You all are what makes this event happen. Your voices, your presence, your commitment and dedication to science. Our children need to see that for the future generation. As a physician, I've dedicated my life to helping people be healthier and to helping communities be healthier through the science of diagnosing, treating, and most important, preventing disease. But we're not doing that alone. We're doing it together. How many people here are impacted in some way by science? Raise your hand. That's right. A shout out to all of the people here who work in science, who have some impact on it. We have people from the Department of Health, Henry and Tom and Joseph. We have people from the Department of Environmental Management who are here. Director Janet Coy is here. This is all important on behalf of the governor and making a statement across the nation and across the world about how important science is. Now, as the director of the Rhode Island Department of Health, I have the privilege of working with some enormously talented clinicians, laboratorians, toxicologists and chemists, drinking water specialists, and other environmental health scientists and public health practitioners who use science and evidence-based public health interventions every single day to make Rhode Island a healthier and safe place to live. Our climate change program at the Department of Health and the other state agencies that are here are all to make sure we acknowledge how important science is for our future. The Department of Health and so many other state agencies and local agencies are also working every single day on anticipating and preparing for human health effects related to climate change. Guess what? Climate change is absolutely real, and it's an absolute public health priority. Our mental health, physical health, and the infrastructure of our cities and towns and the safety of our food and water will be impacted by more frequent heat waves, storms, droughts, foods, and sea level rises, as you've heard about today, if we don't do something about it. For example, we know that many human infections are very climate sensitive as well. This is the case with some diseases that are prevalent on other continents, such as malaria and dengue fever. These are all that could be impacted around the world, as well as in our own backyards, when you think about Lyme disease and Zika virus, which are spread by ticks and mosquitoes that are finding it easier and easier to survive winters in the Northeast. As we work to prepare for and mitigate the effects of climate change, the Department of Health is guided by our vision for a Rhode Island in which no person's health depends on just their zip code. We also believe that your health should not depend just on your race, your ethnicity, your sexual orientation, your gender identity, your level of education, or your income. That commitment to health equity is a part of our very DNA at the Rhode Island Department of Health and in this state. There's almost no issue on which that commitment to health equity is more important than on this issue we're here about today: climate change and the importance of science and upholding that. The reality is that in the same way that the health risks and impacts of climate change are not equally distributed across countries, they are also not equally distributed across communities here in the United States. The same social and environmental factors that already result in poor health outcomes in some communities also increase people's vulnerability to the impacts of climate change. For example, we know that people living in areas with higher levels of air pollution, such as areas near highways, have higher rates of asthma and COPD, which is only then worsened by increased ozone levels due to rising temperatures. So why are we here? Because science and information are the keys to addressing this kind of environmental injustice. Data from public health surveillance and tracking systems are used to determine disease burdens and trends and to identify vulnerable people and places, recognize disease clusters, and plan and implement and evaluate responses. As many of you may know, there is some uncertainty about future federal funding for so many state programs, including those at the Department of Health, to plan, implement, and evaluate these kinds of environmental health responses. This includes our entire climate change program, whose funding is at stake. This is more than just bad policy. This, again, is a form of profound environmental injustice that will have the biggest impact on the most vulnerable of our brothers and sisters, and many of whom live in our core communities and in our rural communities. As discouraging as that may be, look at everyone who's here. We know we can overcome that. Please know that Governor Raimondo, Senator Whitehouse, Senator Reid, Congressman Langevin, and Congressman Cicilline, who's here, with them, we have a group of leaders who have put nothing before your health and well-being, and who are fighting every day for you, your neighbors, your family, and your friends. And they depend on you to push this fight. Please support them as they continue to fight, and please continue to make your voices heard. That's what's most important. You are part of an enormously powerful chorus that is harmonizing across the country today and demanding that we move forward, uplifting science and moving towards a just, reasoned, and sustainable future. Thank you, everyone.